Hi, and thanks for tuning into this session. My name is Leah Marks and I'm a PhD candidate with the Australian Prevention Partnership Centre, and my research is focused on exploring opportunities for citizen science in policy and practice in preventive health. I'd like to begin this session by acknowledging the traditional custodians of country on which I'm speaking to you today, the Gadigal people of the Eora Nation. I pay my respects to elders past, present and emerging, and I extend that respect to any Aboriginal or Torres Strait Islander people who are tuning in today. For those of you who haven't come across citizen science, I'll start by introducing these approaches and some of their benefits in chronic disease prevention and policy and practice. So citizen science is research conducted in collaboration with members of the public, known as citizen scientists, and it can encompass a broad range of activities which actively involve citizen scientists in defining research questions and designing research projects, their collection, analysis and interpretation of data, through to communicating and advocating for findings. Citizen science shares many similarities with other engagement approaches that you may already be familiar with, such as crowdsourcing, photo voice, or community-based participatory research. And depending on the aims of a particular project, citizen science can sit alongside or encompass these different approaches. So why engage in citizen science? Well, citizen science approaches can offer a number of benefits for community members, academics, and stakeholders in prevention alike. In particular, citizen science has the potential to harness the knowledge, skills, and passion of diverse communities and provide access to new data and perspectives that would otherwise be difficult to obtain. It can increase public understanding of and support for prevention actions and equip community members with the skills to contribute to change. Due to these potential benefits, citizen science is increasingly being used in prevention research across a variety of areas, such as food environments, walkability, and tobacco and alcohol control. It is also gaining growing attention by policy and practice agencies around the world as a model for conducting research on socially relevant issues, increasing public engagement in decision-making, and as a way of informing policies and programs to address community-identified needs. We see citizen science as having real potential to bridge the gap between research and practice in chronic disease prevention, bringing together community members, researchers, and decision makers to address complex health issues. However, to date, much of the work using citizen science in prevention has been led by researchers, with only a small proportion of projects conducted in collaboration with policy and practice stakeholders. We know from some of our existing work that involving knowledge users in citizen science projects is really important for maximising the capacity for translation of findings into policy and practice. But so far there's been little consideration of stakeholders' perceptions of the relevance and value of these approaches in their work, and a lack of understanding about whether and how citizen science may be used to address the needs of policy and practice organisations in Australia. So we sought to address this knowledge gap. And in this study, we had three main aims. We first wanted to understand how policy and practice stakeholders conceptualise citizen science and its alignment with their existing approaches to community engagement, any current experiences with citizen science and perceptions of their benefits, opportunities and challenges, as well as what stakeholders see as the resourcing and capacity needs to support and expand the use of citizen science in their work. We took a mixed methods approach which involved an online survey and follow-up interviews with a subsample of survey participants, and we recruited policy and practice stakeholders working in public health and related sectors in Australia. So what have we found? Just to start off with some characteristics, a total of 83 people took part in the survey and 21 of these participants also took part in a follow-up interview. Participants worked across all states and territories in Australia and in a wide range of sectors, including public health, healthcare, planning and public spaces, transport, sport and environment. Most worked in government organisations and occupied mostly senior managerial and executive policy and practice roles. So participants in our study had varying degrees of familiarity with citizen science. Most had heard of this approach, with 3/4 of survey participants reported being at least slightly familiar, and that included 12% which reported being very familiar with citizen science. Half of participants indicated in the survey that their organisation engages in citizen science activities or that they'd been involved in a citizen science project in their work. Only about 6 people that we interviewed described citizen science projects they had been involved in, and these were in the areas of active living, green spaces and walkability, food security and pricing, suburban development, and co-design of healthy lifestyle programs. Now, although only a handful had experience using citizen science, we found there was really widespread interest and appetite for the use of these approaches, with many seeing citizen science as complementary to other engagement approaches. For example, as you can see in this graph, over half of participants saw a role for citizen science in their work and the work of their organisations, and 84% saw a role for citizen science in preventive health policy and practice more broadly. Given the natural alignment between citizen science and similar engagement approaches, we weren't surprised to find the language participants used to describe these was quite intertwined. However, we did find there was a number of defining characteristics that set citizen science apart from how participants said they currently engage with community, such as the nature or level of involvement of community, the leadership and governance of projects, and the shift in power dynamic, which saw participants describe citizen science as a more democratizing and empowering approach. Many saw citizen science as an extension of their existing practice, and when contrasted on a spectrum of community involvement, citizen science was considered to enable more active involvement and through a greater number of project phases. It was seen as more bottom-up and a more equal collaboration than current engagement approaches. We found there was quite a high degree of alignment between current approaches and citizen science for participants who already work in these ways, but for those who do less direct public engagement or who don't engage under a research framework, they tended to see the practice of citizen science as quite different. We also found how people conceptualize citizen science was often intertwined with what they saw as the benefits or advantages of these approaches beyond current approaches to engagement. And we grouped these sort of conceptualizations and benefits under 3 main themes. The first related to an understanding of citizen science as providing a more robust approach to community engagement. Several participants in this study reflected on a history of ad hoc engagement and described feeling these processes could be box-ticking exercises, and they really saw citizen science as putting more of a systematic and rigorous research framework around these engagement activities, which could help lend greater credibility and rigour to qualitative data like perceptions and experiences, which they felt could sometimes be seen as soft. The second area citizen science was seen to be advantageous related to how it was seen to offer mutual benefit for both community members and organisations, something that they felt existing methods often lacked. And this was typically discussed in terms of a win-win that citizen science taps into a captivated community looking to contribute to addressing issues that they're passionate about by providing opportunities to engage and provide valuable data that can't be heard from other stakeholders. Almost all participants discussed the benefits of this access to new and rich data to help them gain a more complete understanding of issues as a way to bridge the gap between population level data and lived experiences of issues on the ground, and to help maximise resources in their often resource constrained environments. The third theme spoke to the opportunity citizen science offered for more meaningful or less tokenistic engagement through seeing community as a genuine stakeholder. And this was seen to offer many benefits, but some of the main ones really spoke to citizen science to serve as a vehicle to raise community awareness and buy-in for prevention actions, as a mechanism to harness community voice for policy advocacy and to contribute to more meaningful and sustainable policy and practice outcomes. And this was through building trust, transparency, and long-term relationships between communities, practitioners, and policymakers. However, despite the significant interest and support to use citizen science in policy and practice, participants also identified a need to weigh benefits against potential risks and challenges of using these approaches, which predominantly included competing organisational priorities, limited resourcing and expertise, the governance and time commitments to design and deliver citizen science projects, data quality and rigour, and engagement of citizen scientists. So in light of these challenges, to expand the use of citizen science, participants felt attention was needed to build broader awareness, acceptance, and capacity for citizen science within policy and practice organisations. They also emphasised a need for greater evidence on the processes, feasibility, and impacts of these approaches to enhance their visibility and legitimacy, and finally, greater access to supporting tools and technology to support their use from the conception through to completion of projects. So I'll wrap things up there, but I welcome any questions about my research, and I really hope to have discussions with some of you through the conference about how citizen science may complement how you engage with the public in your work, or where this fits in prevention more broadly. If you'd like to hear more, please don't hesitate to get in touch with me via email or Twitter. And as part of the Citizen Science and Prevention project, to which my PhD contributes, we've developed a range of resources to support policy and practice stakeholders to use citizen science approaches. So you can access these by going to our project webpage or signing up to our newsletter. You'll also hear about upcoming project events and updates. So thank you so much for listening, and I'd also just like to acknowledge my supportive supervisory team, Sam, Ben and Joe, the Australian Prevention Partnership Centre who fund my PhD, and particularly the Prevention Centre's funding partners who make it all possible. Thanks very much.